Okay, welcome to all the Facebook, YouTube, colleague, friends, senior, junior, who are watching online discussions under the heading Live Pharma Coalitions. Every month, LPC brought to you various pharma experts from the research and development, R&D, academic, quality control, quality assurance, marketing, sales, packaging, regulatory, supply chains, finance, HR, training, and other pharma sub-departments and the departments. This will enlighten about the current happenings and the futures in various department and sub field of the pharma at a glance. So, to begin with the online discussion today, under the heading of the LPC-10, that is a 10th Facebook and YouTube live webinar. In today's 10th Facebook and YouTube live webinar, we have a pharma expert speakers from the majorly from the sales, marketing, and academics. Here we will have our the three speaker today. One is Mr. Viraj Pawar. Second one is the Mr. Rajshekhar, and third is the Piyush. So now also we do have a renowned personality in the sales and marketing as a panelist, Mr. Yashwant Mishra. So now over to Yashwant sir.
Thank you. Thank you very much, Raman. Good morning, everyone. All the sales and pharma guys who are watching us live on Sunday morning. As you know, illiterate of 21st centuries will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. That is the importance, my dear friend, of learning. Although you have some basic learnings, but according to the changing dynamics of landscapes in pharmaceuticals, it is very important for us to learn, relearn, and unlearn. That is why we have created this Live Pharma Coalition. And the sole purpose of Live Pharma Coalition is to create a platform for pharma sales and marketing colleagues who can share best practices of their experiences. And there is a disclaimer before we start. The disclaimer is the views expressed by the speakers and panelists here is their individual expression, their individual views, nothing to do with the organization they are working for. Another thing is there is nothing to do with the Live Pharma Coalition. And another disclaimer is this Live Pharma Coalition is a non-profit initiative. There is no commercial attached to it. So that is for the benefit of the speakers and the viewers. And as my colleague Raman mentioned, today's speakers, and all three speakers are from sales guys, and coincidentally, they belong to three parts of our country, one from South India, one from West India, and one from East India. So we'll get a good combination of all the three spectrum. The first speaker today is Mr. Rajshekhar, who will talk about wanna be a change agent, grab it now. Wonderful topic for pharma and sales guys. Second topic will be COVID-19 challenges and opportunities by Mr. Viraj Pawar. And third topic of the day will be from Mr. Piyush Mukhopadhyay, a salesman view on sales and marketing. My dear friend, to ensure that all of you are also participating, we will have some context also. You can keep on sharing your learnings in the chat box in Facebook and YouTube. We will be having a watch on Facebook and YouTube. And in between, there'll be some questions. And the fastest finger first, those 2-3 people who will respond first will be recognized by Live Pharma Coalition. That is what we are trying to do this time. So over to Mr. Rajshekhar. Please share your presentation.
Yeah.
Mr. Rajshekhar is an MBA graduate having 20 years of experience in pharma sales, and he is currently Director Sales and Marketing in Cipla Respiratory, taking care of South India, mainly Andhra Pradesh and Karnataka. And he is having a passionate about sales and marketing. He is known in his community about the true transformation leader. His followers or his team members are always passionate to work under him. So Rajshekhar will let us go through wanna be a change agent. What are the 4 quadrants of change agent and what we should do on that. So over to Rashikar.
Very good morning, friends. Very good morning, colleagues. Thanks, Ashwant, ICS, as well as Raman, for all these extraordinary support extended. Guys, today my key focus, as the topic suggests, if you really want to be a change agent, here's an opportunity. Why I'm saying like this is a lot of challenges, a lot of difficulties being spoken a lot throughout last 3 to 4 months of this COVID time. So, but at the same time, I strongly believe that a lot of these kind of challenges only throws a lot of opportunities. And as a leader, I have seen many leaders really emerging out of this kind of challenging situation. So my intent today is to really just take you through the opportunities which all of us can really see despite this challenging environment outside. Yeah, Ashwin.
Slide, you can change the slide, Rashikar.
Yeah.
Yes, yes.
So, guys, as Ashwant already gave a brief introduction,
Yes.
I just I just born to an agriculture family in Shimoga, which belongs to part of Karnataka, and basically studied in a rural government school. But life learning is really wonderful there, and thereby, of course, happily married with two daughters, fulfilling the life. And I'm an MBA
Naren,
graduate from VTU, and pursuing right now my career in a company which is 17,000 crore company, that is Cipla. So since last close to 19 years. And agility for change is the hallmark of Cipla, and it is strongly embedded in all of us being a Ciplate. So guys, just to speak about change, all of you feel that when you speak about change, everybody really talks about change, but no one thinks about changing himself. If you observe, it is very easy to say and very difficult to really adopt, and many will preach that's how the scenario is. So keeping that in mind, how best we can really take it into the practice with all your inputs, with all your support, I think that can be a real positive way to move forward, guys. And as far as change is concerned, how that change happens, there should be an agent. So are you the change agent, and are you a leader who is actually the change agent? There the question starts, and from there all of our regular rest of the answers will unfold for our day-to-day work. So guys, if we just observe very important subject today, we thought should be discussing when change only occurs when the support for change, which is going to overpower the force which is inhibiting that change. That means whenever you speak about change, there are a lot of inhibitions. If the force, if the support to intent to change, if it is really overpowers it, then the change happens. And of course, leadership matters an important aspect of it. And if leadership recognizes it and he flexes the meat, then definitely the change is going to happen, obviously. In this process, guys, one thing is very important, that is power and credibility of the leader. If the leader is really powerful in terms of his preparation, powerful in terms of his knowledge, and his execution power, and his credibility means how is his track record, which is really helping to bring in the change. Also, how his team receives it also matters a lot, keeping future in view. At the same time, guys, always change costs something. Definitely change is not an free thing. It really costs many things. That is first important thing is the control. If you just see, whenever a change happens, it is many a times it is disruptive. And also you can also see resistance from within, from outside, from all the corner. So if all of us are really knowing it, and if our preparation and if our support overpowers it, then there is a possibility that change which we are forcing is going to happen in a right manner. At the same time, urgency for change also matters. Guys, if you see, if I'm not willing to change, if I'm not in a mood to change, if that urgency is not there, definitely it's a challenging time. So if that urgency is there, definitely we are definitely going to discard that old and embrace the new one. So that new one itself is the change what we are really aspiring for. Guys, agility is a very important subject. If you see, agility for change is really the catalyst. You see a lot of examples we can see from our day-to-day life. How was the system in a bank when we really wanted to change a mobile number earlier? We have to visit, we have to fill a form. If form is not available, then we have to visit again, fill it and submit with our KYC attestations. Then in a span of a week, sometimes the change used to happen. But now, if you see all direct application logins and in a click of a button, you can update your mobile number and change in the system will be updated within less than 24 hours. That's how the agility for the change. So where as a customer you want to visit, either bank A or bank B, if I ask this question, 100% of the answers today would say that I would like to visit bank B. So this is how the change which is going to happen, guys. So what about the crowd feeling during this change? A mixed variety of feedback you can see from the crowd, either inside or external. Especially inside, you see n number of different feelings the crowd will be passing through. Somebody will feel, yes, this is just a passing phase. Somebody will feel that no problem, it will solve itself. Somebody will say that it's a very, very small problem and we can easily cope up with it. And some will be more confident. They say that, yes, I have seen it earlier also and I can easily deal with it. This is how the thing goes, guys, in your team. I hope you agree with me that you will be having all sort of mix of this kind of colleagues in your team when you are working in a team. Guys, if you see hereby an important subject called room of change. There are 4 important rooms of change. The crux of this complete change environment is these 4 rooms, if you ask me. One, that is really the complacent room. You know, complacent room means we feel that nothing is there to fix and life is going really good. I'm satisfied. And in this entire exercise, we used to set a process keeps going, and we start forgetting about thinking about this entire process because it's used to run almost on an auto mode. But it happens only till a crisis hits, guys. The moment a crisis or a challenge emerges in front of us, this complacency will be undergoing a shocker. So that is a very, very important room of change. And the second one is, very importantly, I am in a denial mood. So if the change happens outside, despite that there is a need of change, sometimes we feel, yes, I am not ready to accept. As long as I am getting that interest, as long as I understand that there is a solution for it, I don't want to really accept that there is a need for change. That is a second key important room of change called denial. And third one is confusion. Some of the guys, when there is a change encounters you, they feel that there is a lot of confusion. So the possibility that they totally surrender to the past and they are ready to accept the future because they are totally under the confusion. That is third room of change. Fourth one is renewal. Okay, so this one is very important, where here we need to really create some sort of an adoption so that will really help them to really take it forward. So guys, if you want to see this entire 4 rooms, all of us, including leaders as well as our team members, most of the time, all of us will be featuring somewhere in this entire 4 rooms of change. And as a leader here, I would like to really recommend you, if you are having a team of 15, 20, please put in each one of your team members into this box. Definitely you will see you are having people in most of the all 4 quadrants. So sometimes many might be featuring, those who are late adopters might be featuring in the first complacent quadrant. At the same time, few might be in the second, third, or fourth. But you should be very clear that where exactly, including us and our team member, really featuring in this 4 quadrant. If you can able to really do it right, then the solution or the answer which you are going to give to your team as a leader is definitely going to be much easier for all of us. So in which room, as I said, if you are really figuring it out, then the solution definitely will be much, much easier. So complacent and I am in a denial mode, I am in confusion mode, or I am in a renewal mode. So what exactly need to do in each four quadrant as a leader really makes the sense. So in that first one, if you see that create awareness, where in the complacent section, you really have to, as a leader, you have to create that awareness so that your team will feel that I understand that problem and make me care so that I can really understand the problem in a better way. Listen to my worries and give me strong emotional reasons to address the current pain. Then what happens? That awareness point really you could able to address. And if I move on to the second point, here we need to really create interest, wherein we need to understand the solution and thereby give me logical, credible reason to show that your plan is giving really a gain to me here. Whenever a leader plans something here, you give the strong reason to your team member that it is really going to give gain to them. And when it move to third solution, that is you need to create trial there, where I believe in solution, reinforce that I have made the right choice and thereby mitigating the anxiety of my team member. So this is how you need to address that, create that third set of team. When it comes to that fourth set of team, where definitely you need to create that adoption so that I will implement the solution if the adoption, if the handholding, if that initial support really comes in. So guys, four different quadrants, four different approaches. If you can able to really do it in a right manner, the biggest challenge of adopting the change, leading the change, you will able to address. So very crisply, these four things you should be really driving through. Create that awareness, create that interest, create trial, and create adoption. Thereby, you will be in a position to really give solution in a different manner to different people. In this entire process, technology is coming into picture in a big way, and also at the same time we cannot forget about the human touch which we all have followed during our leadership journey. Both are actually not contradicting each other, if you ask me. Both are really complementing each other, so that you can use technology at the same time you can really use your high touch personal understanding, personal connection, so that both will complement each other, and thereby you can really bring in a very good positive change. See, guys, technology and personal touch, if you blend them together, there is a lot of benefit. It's taking away the chorus of data crunching and various other administrating challenges and removing that friction, the traffic, that waiting period and everything, and doing things easily wherever high touch is not necessary whenever you use technology, and also use the human touch, especially where there is a high touch is personally required. So looking into all these things, if you see, if you can able to blend this high tech and high touch together, the change is really going to be very much positive. Also, people would have seen a lot of revolutions happen in 1780s, that mechanization, after that electrification, thereby automation, globalization, digitalization, and today it's purely future is about personalization. This revolution is going to evidence a wonderful blend between the human touch as well as the machine. There should be a good synchrony between the man and the machine in the coming era. Thereby, you are going to use a lot of technology, a lot of machine, robots, and many other things. At the same time, it requires a wonderful human touch in terms of making things perfect and to be this person in the driving seat. Guys, when it comes to pharma, this industry is due for long for a big change. And today, whether we want it or not, this COVID has really thrown us a lot of challenge into the pharma industry. And we are definitely going to see big change in terms of the way industry operates. And here the leader has to decide, am I going to really adopt the old version or a new version? So if I ask this question, I think that people will always now look out to think about the new way of looking at it. And we are sure that old way definitely in the short era is going to really have a big challenge. And before going to this slide, I'll ask one question, if you can able to really respond to it, all of you, that whether doctor or patient, whom really you want to keep it, do today, you want to have your doctors or you want to have your patients, who at the center of all the things you do. That will really tell us the way forward for all of us. Okay, guys, if you ask me, in this changing scenario, slowly patients are gaining more importance. Of course, definitely doctors are also an integral part, and they are going to play a key role. And slowly the things are moving towards patient-centric operations, using of technology, using of creative ways of reaching out to the patient, and also putting it innovative ideas in place, and also giving good solutions, important solutions to the current problems which a patient is facing. Guys, moving forward, this one picture depicts what the change which today industry is really undergoing. A lot of technology being used. There is no one-on-one contact happening with a lot of challenges. Therefore, technology usage, distant place connection is becoming the order of the day. You can see doctor is sitting somewhere, patient is sitting somewhere, and through all this technical support, technological support, with this digital innovation, we could able to really have an insight into the patient's world, and thereby doctor can sit somewhere else and he can really offer the solution. So this is a big change the industry is going through. You would have seen a lot of online platforms coming in terms of consultations, as well as they are connecting them to the end point of taking the medicine and monitoring their health condition. So guys, change actually begins with me. Change, as I said in the beginning, change will not happen on its own, or somebody else will do the change for you. Definitely not. Change, I personally feel, should happen, should start with me, and then it percolates to the team or to the surrounding environment. Guys, in order to bring in change, very important behavioral changes we need to really bring in. So that makes the lot of difference. Sorry. So we should really make it easy for the patient. We should really make it attractive, easy for the patient. Not only for the patient, it is for also to the team members. And also we should be making it more attractive, and also it should be making more social, so that all of us really could able to really do it in a better manner. And also it should be very importantly timely. Guys, one thing we should be understanding is these four important behavioral insights will help us to really bring in the change what we wanted to see. If that process is easy, if the change is easy, anybody will adopt. If it is attractive, it gives me solution to a problem currently I am going through, adoption will be much easier. And if it is social, means it is really making difference in the society, definitely there will be an easy adoption. And proper timing. Guys, I personally feel nothing better than this time to bring in a change, because there is a demand for change. So guys, this is what I really wanted to really make you feel comfortable in going through this. At the same time, so purpose is very much important. What I read, what I heard is 30% of the sales managers achieve their target provided they know the purpose of what they are doing. If they are knowing the purpose, then 95% will be success rate. If they don't know it, only 30%. See, understand how much important the purpose is. If I know the purpose, then the achievement rate, then the success rate will be really much higher. And guys, very importantly, a few final comment from my end. If you just ask through, be agile, because the change is inevitable whether we want it or not. Sit back and relax, because a lot of us are going through a lot of tensionous timings. At the same time, we should really able to hit it with a relaxed mind. Plan your career again. The reason being, when you planned earlier, this pandemic was not there in this challenge column which you are listed. And also, guys, the speed of race all of us are running has slowed down a bit in the last 3 to 4 months of time. And reason all of us are aware. Now, along with speed, direction matters the most, because nowadays, if you see opportunities, you tend to see in many directions. Which one is taking you to a better future? That is the important aspect. You have to decide it very, very importantly. And also, many times we are having a lot of hesitation for change. But if you see, when it is articulated well, change many times leads to better outcome. So that is very much important, guys. And being a pharma guy, if you ask me what exactly we want to adopt or I am trying to adopt, is the business dynamics have changed drastically. Last 20, close to 20 years of our experience in industry, what changes we have seen and what changes we are seeing in last 4 months, there is a massive difference. So this is a time where we really need to unlearn, learn again, to plan our business in a better way, and plan the implementation. At times, we will be having a wonderful plan in hand, but we really fail to implement it better. So, guys, we need to plan the implementation also. Thereby, we can have a wonderful outcome. And also, empathy. Today, if you see, each one is facing a different scenario. Each one is having a different challenges to face when they go out to work in the morning. So empathy matters a lot. Either empathy of your team member who is going and waiting in front of the doctor chamber, there is a denial, doctor don't want to meet, or if he might give a passing opportunity. A lot of challenges he is going through. See the doctor, he himself is going through n number of challenges. Huge challenge himself, getting exposed to this challenge. At the same time, he is also having his patients to take care, and at the same time how much time we'll be having to really uh, share it with us is really an important aspect. So empathy plays a major role in today's scenario. And customer relationship management has to be redefined today. Just I will give an example. Somebody wants to really celebrate birthday of a customer and he goes with a cake. I don't know how much relevant at this today's time it is. So I'm just quoting a small example. So CRM really need to redefine, and customer needs have changed drastically. Thereby our CRM also definitely need to undergo a drastic change. And channel has got a lot of challenges. At the same time, it is also getting a lot of importance, because challenging time, their role in making sure that the life-saving medicines available timely at all the place matters a lot. So they play a key role in this today's scenario. At the same time, patients definitely continue to be at the center, at the core of whatever we do. That's going to be an important aspect of our life. So, guys, world has not toppled down. Only I can say the direction, the pace with which we are running has really made a lot of change. Definitely, all of us are capable of adopting that change and moving in right direction. Despite all these challenges, whatever we are talking today, touchwood here in healthcare industry, a very least affected one. And this change is not that big the way many other industries are facing today. So we can really embrace this change in a very, very positive direction. And I think we can definitely move forward in a very, very right direction for a bright future. Thank you all, and be the change you want to see around you, so that the change will be a wonderful thing to embrace today.
Thank you very much, Rajshekhar. Thank you very much.
Thank
Wonderful
you.
presentation. Lot of learning. Please stop sharing your slides so that we can take some questions also. Before taking the
Yeah.
questions from Rajshekhar, a quick recap of what are the take-home message of what Rajshekhar has said. Is told that a process to pass influence is very, very important, right? And changes occur when support for change overcomes forces which are inhibiting change. Very, very important. Any organization, any team, if support for change is more powerful than the inhibition, resistance for change, then only change will happen. That is the new learning we got. Agility is the catalyst for change. Another very important point he has given: agility is the catalyst for change. And another four keys he has given: four rooms for change: complacent, denial, confusion, and renewal. Right? These are the four rooms for change, and influencing the change, create awareness, interest, interest, create trial, and also create adoption. Then only you can bring the change in your team and organization. And so for the behavioral insights or concerns, that he has given the acronym EAST: easy, attractive, timely, and social. Wonderful way to remember what are the behavioral insights for change we have given. Thank you very much. And last but not least, empathy is very, very important, my dear friend. When you are in the field, empathy with the doctors who are facing that challenge, empathy with your team members who are doing their field work in this COVID-19 situation. So it is very important for pharma sales managers and leaders to have empathy with your team members. So really a very important learning. So Rashikar, there are many people who have asked questions. So two, three questions I will take. One of the question from our own colleague Rupesh Joshi. Okay, Rupesh is asking, process, what is the process to influence our team members to adopt change? He is facing a problem that the team members are not adapting to change. If you can give some practical tips how to bring that process or mechanism.
Yeah, if you see, usually what happens, we used to establish a process, thereby it almost keeps running in an auto run mode. So we really don't want to check it, recheck it on a many times so that we are sure that it's going on. But when the change happens, then again we have to re-establish that process. We cannot keep again putting in hands on a daily basis. When there is a change, that change process again has to be re-established. And when we are re-establishing this change process, so definitely we should keep in mind the changing needs of the team as well as changing needs of the customer. Thereby both if we can align better, because where we are roaming between people, business, and the customers. So these are the three subject where we keep roaming around. So if we can able to really foresee these expectations and thereby re-establishing the process, and definitely the team is going to take it up positively.
Thank you
At
very
the
much.
same time, I said implementing the plan is very important. So when we are planning many things, our implementation goes hayward because we don't plan it proper. So that's also matters a lot. Yeah, Ashwin, thank you.
Thank you very much. One more question, my friend Vinod Ramani has asked, why change comes when we force a tough time? This question is, whenever there is a tough time, then only change comes.
Yeah, that means many times you will be in that first quadrant of complacent. Everything is
Exactly.
going right. Why the change is required? It happens like that only. It's not that for him. It happens for all of us also. When everything is going fine, the agility to change sometimes will be lesser because things are going very smoothly. But I'll tell you one important thing. We have seen many leaders in the industry, all of us here, we have seen many leaders in the industry who are emerged out of these big kind of challenges only. So a leader really want to really emerge, use it as an opportunity. And why challenge comes? Because we are not foreseeing many things so that we suddenly encounter a challenge. Sometimes 6 months back, if you would have foreseen that this pandemic is going to come here because it's already there in the other part of the world, I don't know. So those people would have prepared better than others. So somewhere some amount of forecasting is expected, some amount of agility is expected, and some amount of preparedness to a new thing is also expected so that we can handle this without a shocker.
Thank you. Thank you very much. Thank you very much. So with that, we are going to the next topic. Okay, really a very good learning we all have got. And next topic is from Mr. Viraj Pawar. So before his topic, a quick recognition of all those who have shared learning in the chat box of YouTube and Facebook. Mr. Sumit Sharma, Mr. Amin Roy, thank you very much, Amin sir, for your encouraging words. Surajit Ghosh and Manoj, Paras Kamdar, Ali Abbas, thank you very much for your encouragement. Then Vinod Ramani, Rahul Kumar is there, Ajit, Jitin, Sashi Ranjan, and Ranjit Tiwari. Thank you very much, Ranjit. We are looking forward to you also. Arumugam sir, you are in the pipeline. Chakri Sidhu sir, thank you very much for your encouragement. Aman Singh. Thank you, Aman, for watching and encouraging us. Thank you very much. I'm really delighted that you all are sharing your learnings also and asking questions also.
Yeah,
No.
Yashwant, apart
Yes,
from
yes,
that,
yes,
we have in our watch party, we
yes.
have Deepak Loyalka, as
Great.
usual, is a very, a
Uh,
regular student to this life
great,
Pharma
great, great,
position,
great,
and
great.
Vikas Oja, who
Oh,
has
great.
created the, and there were many people have joined.
Thank you very much. Thank you very much. Really, we are looking forward for them also in our forum in future sometime.
Yes,
So
yes.
let me go through Mr. Viraj for our next topic. COVID-19 situation. What are the challenges and opportunities? So Viraj is a master in environment science. Is a director sales, that is digital sales head in Sepla, taking care of Vitalis, and he is having NCCC certificate and worked in traffic police also. Not only that, he is a football player and played national football in NCC group, and also he is a karate black belt champion. So far I know Viraj, he is a people-centric manager, and all his team members, some of the members, he is giving a platform today to express also. So let us hear Viraj. Viraj, over to you.
So thank you, Ashwant. Let us go to the next slide. Thank you for this kind introduction. And before going to my career, I think I welcome all of you on this particular platform. And I think we must all thank to the COVID condition, because this has actually created this opportunity for all of us to get virtually connected. Because till yesterday or till past, probably we used to connect with each other on various platforms individually or one to one. But I think, as Rajshekhar has said, the change is the only way to look forward the opportunities in the life. I think COVID has created that platform and a bunch of opportunities going ahead. Friends, talking about my career, I typically started my career as a medical representative with a Pune-based company called as Libra Drugs in 2001. After completing my post-graduation, and post that, I've started growing in my career with the help of all the team members with whom I worked since 2001. It is all efforts of my team, because of which today I am here looking after Vitalis division, Pan India, which is a cardiometabolic division of one of the renowned pharmaceutical industry called Cipla Limited. So can we go to the next slide? Yes, ma'am. Yeah, friends, Rajshekhar has made my topic very simpler, because he has given a very wonderful message through his presentation about why and how we can adopt the change. And I think the COVID-19 has really thrown us a various challenges at us to look at. And many of our friends in the field probably thinking what can be done with those challenges. But I think we will try and see in next probably 15 minutes how those challenges are really the challenges, or there are some hidden opportunities that also are there in this particular challenges environment. Next slide, please. So this is actually the today's agenda. In next probably 10-15 minutes, I would like to take you through. One is, what are the challenges at really field work, because a lot of medical representatives, area business managers, RBMs, and zonal business managers are probably thinking of those challenges, and they are actually the front runners. Those are actually facing those challenges. Second point we would like to discuss probably is how those opportunities can be seen and observed, and probably the practice going ahead. And this all things we will go through with some of the case studies I've tried to build in. Yashwant, can we go to the next slide, please? Yes, but before actually going into the topic that I'm going to discuss today with you all is, I think I must salute to all of you guys, because our work in the pharmaceutical industry, wherever field that we are working with, whether it is a field of sales, whether it is a field of marketing, whether it is a field of HR, distribution, supply, manufacturing, quality control, so on and so forth, I think our prime goal is to offer that beautiful smile on every individual who is suffering from a pain. So I think with that particular goal, we all are working as a team in various sectors and various segments. And only because of that, I would like to extend my salute to all the warriors, those are currently working in this COVID-19 situation. So along with the pharmaceutical industry, I think there are various other stakeholders, those are really risking their lives and their families to take care of the people, and of course we as an Indian citizens. So I definitely would like to extend my gratitude and heartfelt thank for this particular efforts that these people are putting in today's COVID-19 situation. Uh, as I told, we are really looking at the challenges, but here is a question I would like to throw on the audience. Are we really seeing this current scenario having multiple challenges? You can answer in the chat box. Do you really feel that yes, there are challenges, or there might be some people those are feeling that yes, there are absolutely no challenges in this particular environment? So I'll be just waiting for another 10 seconds to gather the your responses.
Yes, many response I have got, they are saying yes.
Wonderful. So I think before actually going into the this particular platform, I have been talking to my teams even and the friends across the pharma industry. I think many of them are really facing the challenges. So let us see what are those challenges as a unit. Uh, there are few videos that I'm going to share. One is a typical medical representative's frontline warrior, Vipul, who is working, and the other one is the feedback or his experience about the challenges as a manager. So let us go to the first video. Yashwant, I think voice is less.
It is coming.
Yeah.
Coming in the Facebook.
Most crucial global health problem of the century and the greatest problem that the humankind faced since the second. Caring for life. Cipla has always been one of the first to respond in disaster by ensuring the life-saving drug reached those in need. In this tough situation, we try our best to serve humanity and stand with medical practice. Friends, customer connect is one of the biggest difficult problem which is faced by us because from last many months we are not in the field, and many customers are sharing their feedback that they got irritated because of lots of virtual connect by many pharmacies. In this tough situation, prescription audit of our core customer is also one of the biggest problem because chemist person is also having a burden because of the COVID-19. Digital connect like webinar is one of the best way to pass the information to medical practitioner. But in this situation, everyone is trying to engage their doctor via digital connect, and the bombardment of this digital connect it irritates doctor as well as a chemist. So these are the problems which is faced by us this COVID-19 situation.
So being in a manager, three aspects are very much important. I think so. First one is people, second one is a customer, and third one is business. But when I'm talking about the COVID pandemic, all three aspects are really challenging. The first one, when we talk about the people, so one-to-one connect is one of the major missing, and which is the key element of a field industry. And the second one is review their working or the audit their working, and at the same time to resolve their daily challenges, to resolve their queries, what they're actually facing at a field or the doctor level. So that is the one of the most or major challenge which we are facing. Second, when I'm talking about the customer, I think so every industry there are a few customers are very much important to a company, as well as they are the key customers who are driving the business. But at the same time, in this pandemic, to connect with the customer is the major challenge. It's just because of we could not able to make them one-to-one. Digital is far most impossible thing to connect with them and to understand their challenges, and at the same time to resolve their challenges. It's just because of we could not able to make them one-to-one. So digital count is gone down, and it's possible thing to connect with them and to understand their challenges. Secondary business and at the same time, and at the same challenges, just because of business drivers. Count is gone down, and it's possible to connect with them and to understand their challenges. Secondary business
So I think both the colleagues have really thrown the actual challenges those are there in the field. So when I look at the medical representatives' major challenges, it is all about the connecting the customers. So all sorts of customers. Second, as a manager, there are various challenges. Most important, the challenge that he thrown is connecting the team who are the actual front runners, and they are actually taking out the strategies down the line, implementing at those customers and the territories those are taking up. So if you look at consolidatively, the challenges, one is basically the prescribers. So the major challenge in current era is the interface. Second one is the communication, and third one is the demand. So by generating the demand, we are not actually looking at the sales. Actually, we are not able to achieve our core objective of our working, which is providing that beautiful smile on my any individual who is suffering from the pain. If you look at the second set of challenges, is basically on the products. So products, when I talk about, probably we may generate the demand, the individual who is suffering from the pain, he may get that prescription from an consultant, but if that product is not available, then that becomes a more challenge. And in today's era, I think because of the COVID pandemic, transportation has also gone on the toss in majority of the secondary and tertiary towns. So there the reach is one of the important challenge that everybody is facing. Another important thing is, like, if that particular brand is not available in the said market, probably the substitutions are popping up in various stages. There is another important challenge related to product that everybody is facing. And third most important is, most of our colleagues might be threatened about this getting substituted by the generic brands. So the viability and the quality is another debatable topics that we can have, but these are the basic three important challenge at the product that everybody is facing. If you look at our warriors, which are our core assets of any pharmaceutical industry, which is nothing but a people, currently they are facing an important challenge of a threat and the risk of their job. So let us look at, are these are the real challenges, or there are some hidden opportunities are there. So here is another question for my audience, where definitely I would like to scratch your heads to think on the current scenario, whether it is full of challenges or there are certain hidden opportunities that we must look at. So again, I am just giving 10 seconds to all the audience to respond back with their thoughts, whether accepting the facts, yes, there are some opportunities, or you can also deny that there might be certain things which are not full of opportunities. So your 10 seconds starts now.
Yes, Amin, Vardhan and Javed has responded. Yes, they think, Javed, Miban and Arvind, they think there's a lot of opportunities are there. Even Sachin and Dinesh Shah also say there are a lot of opportunities. Thank you very much for responding. You can go ahead, sir.
So thank you friends for responding and sharing your thoughts on this. But I really salute your thought process, where you're really looking at the opportunities in this scenario. So here is another important video that I would like to share. Yashwant, can we go to the next slide, please? Where one of the senior zonal manager is sharing his thoughts on opportunities.
Seems it's not audible, Yashwant. Voice is
Yashwant?
not coming.
Yashwant, voice is.
Is increasing. We should maintain our alertness,
Yes.
our connect with our customers in these pharmaceutical sales. That is retailers and distributors. Another
Okay,
third
now it is
category,
coming.
doctors only. Doctors are helping us, though we are not meeting the doctors, but during this pandemic situation, we can connect with our core customer telephonically also. They are giving enough time when we are connected telephonically also.
Yes, it's
So
coming
we
now.
should maintain this strong connect with our core pillar of this pharmaceutical sales, like doctor, retailer, distributors, and all top core customers of these industries. So we should not lose the grip from this customer. In this scenario, we should our approach is towards the service to service our patients and to service our customers, and we should not miss this opportunity.
So this is the leadership approach. I think wherever the challenges we came across, we must look at the opportunities hidden into this. So those opportunities we must observe wherever the challenges are there. So it's a request, all of you guys, like Rajshekhar has already shared in his first presentation, how we can pass through those 4 rooms of adopting the change. So to adopt that change, I think one must observe the things very carefully. So whatever situation that we came across, I think observations can make you realize, yes, there are few things which we might not have tried in the past. So let us try those things in coming time. And I think for that, you must keep on learning the things which are happening around us. And it is not only the learning that will make us confident. So the confidence will come, of course, with the knowledge, but that confidence will get developed when we'll start implementing the things in actually into the ground. So as a pharma colleagues, when we start looking at the opportunities in the current pandemic, I think along with the learning platform, those who have been created either by the organization, or there are multiple channels available online currently through which we can upgrade ourselves, and we can definitely improve our skill set, and which will help us definitely to implement the things. And it is not only the opportunity that we must talk to. If you look at in during current COVID condition, when initial lockdown started, everybody was thinking about how the pharma industry will grow, then how the sales will happen. Many of the medical representatives, or even at the first line, second line managers, they were thinking that how the sales will happen, how I am going to connect with the customers, how I am going to connect with the retailers or the distributors to make sure my sales is happening around those areas. But if you look at running like online platforms which have been created either for the pharma industry or for the rest of the industries happening around, those have really served the humanity in a very different way and a very positively. And I don't think that wherever these online platforms have shown their reach, the population in those particular areas have got deprived of any of the necessaries or necessities they were finding through. Second, if you look at a current market, as per the ORG, if you look at the chronic segment has really boomed. And in the same segment where the transportation challenges were there, but I think the chronic segment has really boomed like anything. Even the government, the strategies which were being laid down to take care of those things, I think those were phenomenal. And everybody is now, even though they are not going out of the home, they are getting all the necessary things at their places. So I think one must look at those opportunities within the things. In last couple of months, if you look at, there are many online businesses have been started. So this is what is the opportunity that we must look at, and we must try and implement. But with this, what I think is the most important thing that everybody should now think going ahead is that the person who is fit is only going to survive. And as Yashwant initially said, in coming time, probably the person who is having knowledge may not be the illiterate, but the person will remain the illiterate if he or she is not going to adopt the newer ways of lifestyle. And I think in that context, we must try and upgrade yourself in those contexts to survive in coming time. And as everybody knows, necessity is the mother of all inventions. this proverb is completely applicable in today's life or today's world. We have to keep on researching the things where we must find out the opportunities to take our ambitions to level next and to reach out to the goals those we have trying to observe or achieve in our life. So can we go to the next slide, Yashwant? So I think there are a few couple of take homes that we must try and adopt. First most important thing is we have to adopt the new way of life in pharma marketing. It is whether it is marketing, whether it is sales, we have to look out the new ways of life, how we can learn and how we can start implementing this. Most importantly, upgrade yourself with learning by adopting various ways around you. Reach out to the various people, reach out to the various segments, and learn how they are adopting newer ways to take their objectives ahead. Start working on the findings, newer opportunities. I think the Sachin, who is a zonal business manager, he has laid down the various opportunities for the pharma colleagues. But it is not only for the field people, those who are working in the field, but other segment also. There are various opportunities that are lying in front of us, but probably we have overlooked it in the past. Let us start engulfing those opportunities and let us try on those opportunities to get some good outcome out of it. Last but not the least, find out the various own ways to make your conversations interesting with the stakeholders. Because in today's light, or wherever virtual platforms are available, we are trying out various ways to reach out to the customers and the stakeholders. But I think the person will lead the show who is going to adopt the way by which he or she is going to make his conversation interesting. And above all, I think you have to believe in yourself, because world is there to help us and we have to adopt various ways, and that will happen only when we are going to believe in ourselves. Yeshwan, can we go to the next slide, please? So I think with this, I would like to congratulate each and every medical representative and the entire field who is there associated with this marketing. 1st August has been kept as an National Medical Representatives Day. And as said, our job is not only to generate the demand or to sell the brands. Our core objective of our entire working is to offer that beautiful smile on that every individual who is suffering from the pain. But before ending my particular this talk, I would like to take you to the small video where you will see some very beautiful message been kept for us, because currently everybody is thinking in today's world is why it is happening only with me. So Yashwant, can we play that video, please?
Recently, a guy came up to me and was grumbling about all the problems, the troubles, the difficulties that he was going through. He had just recently lost his job for no reason. His relationships were in a deep mess. Nobody was trying to understand him. Everything was going wrong, and he had done nothing wrong. And all through the conversation, he kept asking me, why is this happening to me? I'm sure a lot of you can relate to the situation that this guy was going through. I told him, look, man, do what you can do to sort it out. If it's your fault, correct it. If it's someone else's fault and that person is within your access, discuss with them, communicate to them. Very often, however, what we go through is neither our fault nor the fault of someone else. For example, a serious disease that we go through. We didn't do anything wrong to get it, and nobody else did anything wrong to have us get it. How do we deal with it? Here's what we do. A little boy once came running to his mother and asked her, "What are you doing, Mom?" She replied, "I'm making a beautiful embroidered design on this nice cloth." The little boy looked up to the cloth securely held in the wooden ring, the hoop, and complain, a design? All I can say is just some colored threads, yellow, blue, red, black, pink, all tangled up, all messed up into each other, all complication. And you call it a design? The mother picked up the little boy, put him on her lap, and said to him, "Now look at it, my son." And the boy saw a beautiful design, an incredible pattern, a systematic plan and a layout evolving on this cloth. The mother said to the boy, "When you look at the cloth from your side, all you see is a mess. When you look at the cloth from my side, all you see is a beautiful design, a pattern, a plan." Ladies and gentlemen, when we go through the helpless, overwhelming challenges in our life for no fault of ours or no fault of anybody else, and we cannot do anything to sort it out, if we see and look at it from our point of view, all we see is a mess. All we see is situations and events tangled up and jumbled up to create that mess. But when we look at the same situation from life's point of view, from God's point of view, we see a beautiful design, a pattern, a plan evolving in our life. In fact, for a beautiful design of embroidery to happen on one side, you cannot avoid the mess on the other side. And it's not just the nature of embroidery, such is the nature of life as well. This outlook actually gives us a very deep sense of inner strength and fortitude to face such helpless, overwhelming challenges in our life. Thus, I say, change your vision, and your vision will change you. Thank you very much.
So thank you, Yashwant, for this wonderful video. And I'm sure every person on this platform probably have received that wonderful message, how that vision will change your way of life. And I think with this, I would like to extend my gratitude and heartfelt thank you for each and every person who has been attached to this. And stay safe, stay healthy, and please convey my regards to all your family members. And by staying safe and healthy, let us lead this pandemic with a lot of challenge, observing observations and implementing a lot of learning those who are happening around us, and engulfing few of the good thoughts, and definitely going through the 4 rooms of changing yourself. Thank you so much. Please do take care of yourself. Stay
Thank you
blessed.
very much. Thank you very much, Viraj. Really wonderful presentation. Again, we should say a newer perspective to the same topic. Topic is same. Our key challenges and opportunities in post-COVID area, but you have given a different perspective to that. A really good insight. Just to quick recap, take home message. Lot of questions are there for you. So what you have told about is the challenges at the prescriber level, that is healthcare practitioners, challenges at the product level, how to ensure the availability and supply chain, challenges at the people level. These are the three key things you have told regarding challenges. And then you told, apart from the challenges, there are opportunities also, right? And opportunities through observation, through learning, through implementation. That is what we have to look forward for. And take home message is adopt new ways of life. We all, looking into the situation, should adopt new way of life, upgrade ourselves with learning. As Viraj also mentioned, we need to keep on learning new things. Now we are learning digital. Tomorrow we have to learn something new also, and find newer opportunities. We all should look forward for newer opportunities. What are the new opportunities we are around us, and how we can grab those opportunities. And then last but not least, own ways to make diagnosis interesting, dialogue interesting. When you are interacting with the doctors, make sure you make the routine dialogue interesting so that they will find some value in it. Thank you very much once again, Viraj. Some of the questions, particularly Vikas Pal, Javed Neman, and Amit Vardhan, these people have asked questions. So I will take Vikas Pal's question. Any motivation tip you can give for the team motivation, Viraj sir? What are the motive you can give in this current situation? Motivational tips for the team. How to motivate team? Yes.
So I think really wonderful question, and I think in today's era, motivation always remains a big challenge for all of us. But given in this particular field, for us, the biggest motivation is, as I always see, the good, beautiful smile on the end product user, which is our patient. So you try in various ways how you can train your people to reach out to these patients to offer that beautiful smile. That is number one.
Wonderful. Yes.
Number two is, most importantly, you have to create that friendly environment with your team members who will communicate that message about importance of being livelihood with our stakeholders. I think if you start adopting these two things, probably motivation will come as always. The second side of the coin is, this question comes and been asked by either medical representatives or the managers or the team members within us. But the same question they will never ask in their family, because in that family, that environment is such, the friendly environment is there, they are so well connected with their family members that doesn't require the motivation. They keep on just traveling towards the common objective what they set for. So this is, I think,
Okay. Good
suffice
thought.
your
Really,
need,
I
because
think. Yes. Thank you. One more question I will take from Javed Memon. How to overcome basic working challenges, particularly coverage issues? As you know, MRs and first line managers are not able to cover, and companies asking for 10 doctors, 11, 12 doctors every day coverage, but it is not possible in today's era. So, how to overcome this coverage issue?
So I
Any
think,
tips?
Javed, wonderful question again, and probably you are representing the question from all 20,000 pharma companies, those are operating in India, and the medical representatives, those are there. I think in my take homes, the last statement which I made was, only thing to cover those your customers is via virtual connect in current era. There are very few selected areas where now one-to-one connect is happening, but most of the places now we are going through the virtual platforms. And I think unless and until you make your that connect very interesting, I think customers are not going to reciprocate in that way. And ultimately, it is not the coverage, it is the sales that is forcing us to ask that question to our field colleagues, why you are not able to meet the customers. And I think if you'll start making your coverage interesting, I think the sales will automatically come, and probably that question will not arise during your discussions.
Thank
I
you
hope
very much.
I
Yes,
replied
but
positively.
quickly, the last question, that is Amit Vardhan is asking, how to keep a balance between personal priorities and professional priorities in COVID-19 situation. Right.
Very wonderful question, and I think I'm really thankful for you to ask this question, Amit. In this today's pandemic, if you look at now, most of the places work from home is either happening wherever the lockdown situation is there, and in some places where the operations are on, we are only getting 5 to 6 hours to spend in the field. But at rest of the time, I think we have that quality time everybody is getting to invest with our core family members. And I think that quality time spent will definitely offer you a good quality life with entire your family members. I think you have to utilize that particular time very judiciously to spend with our loved ones in our families. And I think that will create that balance very beautifully going ahead.
Thank
Thank you
you
so
very
much.
much. Thank you. Please keep on login. At the end, we'll have some more questions to review.
Yes,
I
yes.
see, sir, any views from YouTube? If you are watching, I have been able to follow Facebook. So I see, sir, anything you want to share?
Yeah. One question from Vikas Pal: how to
Okay.
create an opportunity to team level, and how can we
That
inspire
covered.
for a longer duration? Because maybe we all thought when the COVID started, it was only for 2-3 months.
Sure.
Now we realize that it's for a longer time. So how to still keep them motivated? So that's his question.
Yes, yes. Here already answered that.
Yeah.
So by having empathy to the people, by understanding their situation, and also instead of forcing them to do things, make them realize the situation and what are the opportunities are there, right? That is the way. So once they are convinced from inside, they will be able to adopt the new change. That is what is the point here. So thank you very much, sir. Now
Yeah.
we can
So
go
what
to
are
the
the
next.
different
Yes,
ways?
yes, yes.
What are the ways to engage?
Sir, your audio is not coming. I see, sir. What
So
are the
apart,
ways?
yeah, apart from webinars, are there any other
Ways to connect with the doctors.
connect with the field force? That is without the
Okay, okay. Any other ways?
So,
Telephonic call is there? Yes,
yeah, yeah.
Viraj.
So here I would like to just share my thoughts. Yes, definitely the webinar is a one way by which we can connect with, but I think there are multiple platforms within, like Microsoft Team has created, through which we can virtually connect with our team members on their routine daily working things. So that is another way. Second one is, yes, in most of the places and most of the companies, and even some of my friends, those are working with the pharmaceuticals, they are connecting casually with the team members most of the times to understand their concerns or challenges, to help them out and to empathize their conditions wherever they are. So in today's world, I think the only virtual platforms are available, and WhatsApp, video calls, Google Meet, Zoom meeting. So these are the platforms, these are already available, and I think almost 90% of our team members are getting connected with their team members in those platforms only. But the only thing is, most importantly, how we empathize and how we sympathize the condition at that point of time will definitely make a huge difference.
exactly.
Okay, thank you, sir. Thank you very much.
Personal skills and your empathy is more important than the business. So you should
Okay.
always be human before you're talking about business. As a
Thank
manager.
you very much, sir. Thank you very much. I request Pijus, our third speaker, to share his point. Pijus, also unmute your mic. Pijus, unmute your mic and share your things. And before Pijus start, let me recognize all those who have shared very good things. Surya Sai, Kamlesh Nayak, Sabyasachi, Gulbir Juneja. Thank you very much, Gulbir. Dheeraj Dikshit is sharing a lot of learnings. Dheeraj, Tahir Qureshi, Ikra Sheikh, and Mohammad Najim. Thank you very much for being there. Sumit, thank you very much. Again, you have shared a lot of new things. We are really encouraged to see your things. Now, Pijus, as is our third speaker, and he's going to take us to a wonderful topic again, a salesman's perspective on sales and marketing. Pijus is B Pharma, PGDM in international marketing, and also he's certified professional in people analytics, finance for non-finance, and marketing and digital marketing. So Pijus, as I know, is very active in social media, particularly in LinkedIn and Facebook, and a lot of articles on leadership you can find Pijus. I also follow him on leadership skills. So Pijus, thank you very much for coming and delivering the talk. Please go ahead with your talk.
Yeah. So thank you, Mr. Yaswan, for giving me this opportunity, and thank you, my co-speakers, and for talking very relevant topic, which is very, apt for the current situation. So first of all, I'd like to thank you that all of us sharing our time, and I'm told that a lot of students will also log in. So thank you very much for sharing your time with us. So, Mr. Viraj and Mr. Rajshekar has shared a very relevant topic. Mr. Rajshekar talked about change management. So what I believe is that in the world, in the whole world, that there is only one thing is constant, that is change. And how to manage change, it's better that we need to know right now. Second part that Mr. Viraj talked about is opportunity. So whenever there is change, there are a lot of opportunities. You go outside and you see the particular person who was selling flour earlier, right now selling mask. So he has actually got something out of the change, and he has grabbed the opportunity. So I'll just request all of you. So think about a particular college and a classroom with 7.8 billion students who are learning the meaning of wisdom, definition of freedom, and importance of failure. Yes, I'm talking about the world population right now as a student and the world itself as a college. And just imagine that we are into a course in this particular college. And if we can term this as COVID, the meaning college of volatility, insecurity, and disruption. And if somehow we manage to pass this particular situation, we can call it ourselves proudly that we are COVID graduate. And believe me, we are super lucky, because if this situation would not have been there, we would have missed a lot of experiences. Experiences like, first time ever we know that our salary is sufficient to meet our need, not greed. First time ever we know that work from home is possible in pharma sales. That is nothing to do with the IT industry only. First time ever me and my son attending same class, junior KG, in online platform. First time ever I seen my friend has quit smoking after 12 years. And first time ever we know that since so many years we are pretending to be busy. Actually, we're not. A sense of deep self-realization. So these are the life lessons that we have learned in this particular phase. And there are a lot of others professionals. So my dear colleagues, today I'm going to share my perspective on sales and marketing. So let us start with the first part, that is our very own sales. So here in both sales and marketing, I'll be sharing the strategical part of it, not the tactical part of it. So might be that strategy is a broad terminology, but it is nothing but the kind of choices that we make in this particular situation. Someone has really nicely said that strategy is nothing but the conceptual clarity and contextual familiarity. So let us see what happens next. So many of our colleagues and we are thinking, is it a time to start? So this is the first question that many of us are asking to ourselves. And also there is a second question that we are asking out to ourselves, is that when this pandemic is going to end. So according to the historian, the pandemic end has two particular situations. One is medical part of it, means the medical, which occurs when the incidence of death rates plummet. And the second part of pandemic ending is social part, that is when the epidemic of fear about the disease wanes. So when somebody and any one of us is asking when this pandemic will come to an end, we are basically asking the social part of it. Means the fear of pandemic, when the disease of this pandemic particularly wanes out. And believe me, ending in this social ending has already started. People have already started moving outside of their house with all the precautions. The economy has, it is moving to slowly though, but in a positive side. So my dear colleagues and friends, it is time to start. And also, whenever you are starting, I would like to think yourself as a sprinter, because here we are about to run a marathon with a sprinter pace. So you can't run slowly right now. Already 3 months over for the financial year. Already only 9 months is there. So you need to run a marathon with the pace of a sprinter. So for that reason, what you need to do, you need to get your head straight. You need to see that what is there ahead of you, that you have to be very much well acquainted with. Without that, you can't run. So once somebody asked Michael Schumacher that how it is possible that how this much first you are driving through the particular track. Schumacher said that I have been driving on this particular track before the race since last 10 times I'm driving on this particular track. How is it possible? Somebody asked. He told that in my visualization, I have already finished the particular race. Similarly, before you are starting your planning, you need to build awareness about your internal and external insights. Without data, without the proper insight, both internal and external, you can't move ahead. And if you are moving ahead, you are just throwing stones in the dark. The second part is that you have to create a lot of simulation situations, and you have to make your team go through that, because you never know what kind of decision you have taken and what will be the implication of those decisions. So these simulations in this particular situations is very much important. Third most important part is that realign the top team and energize the workforce. Believe me, my friends, right now, all the managers and leaders has to work like a box full of positiveness. positiveness, and full of motivation. So whenever somebody is calling you, he or she should not drop his or her call without getting motivated. And how you will get motivated? Definitely, the self-motivation is the biggest need of the hour. Second part is that if you want to really run fast in a sprinter pace, you remember, you need to set away your extra kilos. That is, you need to burn your fat. So lean out all the repeatable processes and the low value activities that we used to do since last long time. Clarify the roles to force clear accountability. There is no place of overlapping of roles. A ABM can't do a TM's job, a RBM can't do a ABM's job, and so on and so forth. So accountability part has to be very much clear and well defined right now. And you have to set your best of the best productivity standards and cost control. And last but not the least in this part, protect health. That is very much important. Yourself, for your team, for the society that you are living in, for the family that you are into. The third part of it is that build muscle selectively. So if you want to be a sprinter who is running a marathon, you have to have a very strong leg. That means you have to build your muscle very selectively. So for that reason, free up leadership time to concentrate on the critical task. You don't have time to waste your time right now. For that reason, you have to very much focus on what you want to do, what you don't want to do. You can't mess up your daily routine. You have to reset your business and personal targets and scorecard, and obviously build functional muscle in the high value areas. If I talk about the functional muscle, it is just about like innovative pricing, customer insight, key accounts management, the tendering process, which is changing like anything in the B2B marketing, and obviously the business development. So 3D technique that you may apply, that is decentralization of the PowerPoint. Leaders and all the managers has to share their power never before. Delegate your work properly. This is how you will be realigning your top team and you will energize your workforce. Do not micromonitor. And also you have to take decision. You can't delay on the decision. So that is the most important three factor I would like to comment. The second part is that communication. Now communication is a vast topic and we all know the importance of communication. But here I'm going to talk about the importance of the risk communication. So sometimes many of us may be thinking that, in this particular time, if we are communicating the risk factors, team may get panicked. But research shows that in crisis, people typically respond responsibly, even bravely, when risk messages delivered properly. So the better the information, the more effective the action. And if you are not communicating the risk message properly, then your credibility will be at stake. And all the stakeholders, like the employees, the colleagues, customers, suppliers, investors, they will look for some other source of information. And you will not have any control on that other source of information, what kind of information they will be gathering towards. So communicate and the risk factor, and you need to be champion on this particular risk communication. And fortunately, it is not very hard to do. You need to ask just yourself three questions. One, what information do people expect from you? That is number one. Second, what does your audience currently believe? The belief system of your audience is very important. You believe the doctors or your customers or the consumers are free right now. The customers and consumers believe that somebody else is irritating them. So the belief system is very much important to know. It is not that what you think, it is important that what customers think actually. And do you know that? Third is, do you have resource to communicate your message? So what are the resources that we are using right now? So somebody was asking about the resources. So there are a lot of resources available. The Zoom meeting, the Microsoft Teams, the telephone, the message, WhatsApp group, you name it, we have it. YouTube links. Choose your resource properly so that you can communicate your message in a proper manner. One more important part in this particular section of sales on a strategic point of view, that your influence diagram. So draw your own influence diagram. What is that? It is nothing but the visual display of a decision problem. So it is having a three nodes, one decision, Second is the chance variable, that what is the outcome it might bring. And the third is that a final valuation. So suppose you are into a particular situation right now that we all are into. The particular sales activity budget is less. The consumer, the patient's part is, daily it is shrinking, or maybe right now it is improving, but it is in a shrinkage shape. And you have a very less sales activity budget to spend in the field. So what do you do in this particular situation? What kind of decision or strategic choices that will make? And what kind of outcome that you are expecting out of this? And how do you like it? So what is the difference between the outcome and the how do you like it? So suppose once I already communicated that you have a less marketing activity budget and you have decided on something. Now what you want top line improvement and bottom line improvement together, or you want to, you are ready to negotiate with your top line and you want to further develop or strengthen your bottom line. And how do you like it? How do you like it means you need to realign your team with the thought process of selling high GC brands. You need to realign the product positioning, the P1, P2, P3, P4 that you are detailing to the customers, all that you need to think. So influence diagram for the sales people in a strategical way is very, very, very important. So there are three important things to remember as far as the sales is concerned. Number one, pace. Remember, we talked about becoming a sprinter who is running a marathon. Speed is more important than ever right now. Agility, we have already talked about, and like ever before, it is one of the most important factors. Third is avoiding satisfying the false democracy of setting identical targets across multiple areas. So whatever the formulas we used to use for setting up the targets, incremental sale, value-wise sale, 10 doctors is writing 2 prescriptions, so 2 prescription it is becoming 20, so this many prescription will be generating, so this will be the target. All that needs to be, we need to set out all this thinking. We need to see that how the market is behaving, where the patient flow is there, where the patient flow is not there, what kind of product that we need to sell, what kind of value we need to generate, and at what cost. So that is most important. So avoiding satisfying the false democracy of setting identical targets across multiple areas will help you out. My next views will be for my marketing colleagues, which is one of the most important factor. And in current situation, if I say it is the important factor and deciding factor, which will tell you what will sell, what will not. So to all my marketing colleagues, there is one question that, are you ready for the next pandemic? This question might be irrelevant right now. It sounds like what I'm asking, am I expecting a next pandemic? But do we all know that 2000, the world has seen 69 global and regional specific pandemics. So the pandemic and crisis is not new. Our thought process that pandemic is new, it is the new. So we need to be prepared. We need to get prepared for the next pandemic as a marketeer, for the next crisis moment as a marketeer. So there is a who model that anybody can follow, that at what phase pharma companies should develop risk mitigation plan. The marketeer should develop a risk mitigation plan. So at the third phase, where there is no or very limited human-to-human transmission, in that phase, you need to have a strong strategic marketing plan that will drive the change. So it will be, more of not by default, but by design. So once I'm asking that, are we ready for the change or are we ready for the situations? Because there is a shift in the train in pharma right now. The whole sales and marketing model has got changed. There is shift in the portfolio focus because, as a mentality right now, those who are there with the, PPI segment or the liver disease on this particular therapy, due to the hygiene factor got changed. People has become more hygienic. All these sections, sales or the unit-wise sales or the brand sales will go down. That's what I think. So what is your shift in portfolio for the near future? Shift in the pricing model. Right now, if I talk about in B2B model, a lot of the institutions, hospitals will be not holding up the stocks for the longer days due to the cash crunch. So there will be having a lot of negotiation pressure. Might be it is ending up with the bargaining. So what kind of pricing model that you have, what kind of shift in pricing model that you have, and also what kind of shift in communication, because more or less whatever the communication we used to do, it's a one-way communication. Right now we have to design and develop, and we need to go with the two-way dialogue communication so that we can address a larger number of stakeholders with us. So let me give you an example, real life example. What do you see here? A particular person is selling books at traffic light, but it is not. Actually, it is the world's smallest bookstore that we see in our in daily day-to-day life. And it is considered to be one of the most important efficient product positioning, because this particular guy can hold maximum 10 to 12 books at a time, and holding up this 10 to 12 books for 5 to 6 hours, you know, it's an Herculean task. It's not an easy job. So this boy do not have the democracy or fancy of selecting a lot of books and keeping it on the hand. So he needs to know the trend of the books, which book is selling, what book is not selling right now, and which books to be kept up, which books to be kept down. And whenever the car comes, as per the car's model, he picks up a particular book and he offers to the customer. And he is having just 1 minute time to negotiate and close the deal. One of the smartest salesmen I have ever seen, isn't it? Yes, it is. So here, the most efficient product positioning. So how does this correlate with the pharma marketing right now? Think of like in the current situation where almost no one is reminding a doctors about the particular their brands. Is your brand comes in the top 5 brand recall by an HCP right now? Because right now we all in a very smaller way sending our brand reminders to the doctors. Doctors are not entertaining medical reps and the pharma guys majorly. So which are the brands right now is moving? That is the baseline. So if your brand is there in the top 5 list of a particular HCP, then you know that you are in right track. And if not, then why? So we need to get the answer. If yes, then why? If no, then also why? And your internal and external data will give you the right answer for that particular thing so that you can design. So while you are designing some kind of product positioning strategy or your portfolio strategy, you can follow, you have to draw your own strategic canvas. You can't swim in the red ocean right now. You have to create your own blue ocean and the strategic canvas. So for that reason, you need to see what to eliminate. Might be all the physical LBLs that you used to give. You need to stop it out. Might be, you need to design the content in a proper way. What you need to reduce might be the, digital conventional load that you need to reduce. Might be you need to raise the standard of the communication. And you have to create your own strategic canvas to beat up the competition. So those brands which are moving right now, analyze those brands and see whether your brands comes to this particular list or not. If not, then why not? Draw the strategic canvas, design the proper strategy, then start the communication. This will actually ease the life of the sales representative who are all right now standing in front of the doctor, believe me, without some meaningful messages to deliver. In that particular bargain, we need to balance the customer versus consumer. Now think of a situation which is quite common right now. There's low patient load right now, the limited movement of the people in outside, and we all are doing work from home, most of us, but still chronic segment is growing and reporting 100% achievement. So how does it happen? Nobody is sending brand reminder. Nobody in that particular frequency, nobody is meeting the particular customer. Then who is driving this particular growth and 100% achievement? Is it the consumer, which is most neglected one, might be in the strategic part, or it is? I don't know. So patient-centric marketing model is there, will be helping you a lot in the near future. But once I say that we need to design, we need to strengthen the patient-centric marketing model, I'm not diminishing the importance of customer. It is the most important factor. So we have to find out a perfect balance of C versus C, customer and consumer. Just one more example I'd like to give. We all know the 1mg, your go-to health app. So if suppose you are searching for a particular brand X in 1mg, you have typed. So that particular search will also give you the substitute brand range. Suppose you are searching for a brand X, the MRP is 100 rupees. So that particular search will also give you a result that substitute brands are available A, B, C, and the price is 105 rupees, 90 rupees, 85 rupees. So here consumer will be deciding, and he will be forcing the customer to change from particular one brand to other brand. So as a marketeer, do we have our presence so that we can, you can see that patient doesn't change the particular brand which has been suggested to them? I know there are a lot of factors, but think about it, that how to go ahead with that. Science and service, the two S of pharma industry, has to be properly balanced, because right now you need to, you need to just see to it that which part you will be focusing more on, the science part of it, and if it is there, then how, and the customer service part of it, if it is, then how. Because only communication is not important right now, the purpose behind the communication is very important. Anybody, any marketing people, any sales people is right now connecting to the customer, the first question they are asking, what is the purpose of your call? Might be a digital call, might be a face-to-face call, but the purpose everybody is asking right now. It's a trend right now. Do we have the purpose clear? Do we have the purpose mentioned clearly and explained clearly to the field guys? Think about it, because the time has become precious, than ever before. And our customers, fortunately or unfortunately, having the same customer, the same time to either to listen not so valuable generic talk by a sales guy or attend a valuable patient. Now, if you would have been there in the customer part, what you have chosen or selected? Think about it as a marketer. One more important fact is that customer loyalty. So, or a reason for loyalty. Ask this question to every strategic decision brand-wise that you are taking or we are taking. Because it is high time for pharma marketeer to think about customer and consumer loyalty program, just like other industry. Think about it, that how we can drive this particular section, because only short-term onboarding of customers will not make value cost trade-off. It is no more relevant. Pharma must embrace social media, and you know why? Because through social media we can educate to the consumer and the customers. Marketing initiatives can be taken, connecting with the healthcare professionals and connecting with the patients moreover. And above all, most important is that listening. You can listen that how the market is behaving on the particular brand or particular campaign. So you have to get your online strategy in a very good way. So one particular survey that I would like to share with the DocPlexus, India's largest community of doctors, conducted survey with more than 12,000 doctors. And you will be surprised to see the result. 83% doctors agreed online learning. 71% found easy to gain knowledge from KOL. 78% preferred video content. 72% feels easy to source drug information. 75% doctors spend average 5 minutes, and 10% spends more than 10 minutes. Now, these 10% who spends more than 10 minutes is your KOL. You just see how you are present in these 10 minutes. And also, if I talk about the peak surf time, sorry, so that is 10 a.m., 2 p.m., and 9 to 10 p.m. at night. So think about it. What kind of content you want to deliver at this particular time? Is it worthy that a customer will spend a minute of time for your content? As a marketer, we need to think about this particular situation. Digital marketing is, we know that is a future, but here the hero is not hero of the story. The story is the hero of the story. Content is the king right now in digital marketing. And also gamification you have to use as a tool with gamification as an objective. So it has to be very much, communicable point. It should not be that the kind of message only that you want to deliver, that is only you are uploading in a gamification model. But also you have to see that how a particular patient or how a particular doctors can engage themselves with your particular digital marketing strategy. There are many digital initiatives that MNC companies in India have taken, like Knowledge Genie, for the physician about Pfizer, the rep triggered email and equipment for the doctors. Me without migraine for all the stakeholders. Jason Pharmaceutical Company is famous, online campaign. So that they have that you can just go through and see the model how they have got success. Because post UCPMP implementation, conventional generic marketing will be obsolete. And once again, the question is, are we ready for that? Because many of us are thinking that the future is in future, but in my view, the future is here and it's no more in future. So if I can just play a small video, I'll ask Mr. Pharma to play the video for me.
Yeah. I'll share.
4 years ago, we started to wonder, what would shopping look like if you could walk into a store, grab what you want, and just go? What if we could weave the most advanced machine learning, computer vision, and AI into the very fabric of a store so you never have to wait in line? No lines, no checkouts, no registers. Welcome to Amazon Go. Use the Amazon Go app to enter. Then put away your phone and start shopping. It's really that simple. Take whatever you like. Anything you pick up is automatically added to your virtual cart. If you change your mind about that cupcake, just put it back. Our technology will update your virtual cart automatically. So how does it work? We used computer vision, deep learning algorithms, and sensor fusion, much like you'd find in self-driving cars. We call it Just Walk Out technology. Once you've got everything you want, you can just go. When you leave, our Just Walk Out technology adds up your virtual cart and charges your Amazon account. Your receipt is sent straight to the app, and you can keep going. Amazon Go. No lines, no checkout. No, seriously.
Next slide, please. So we have seen that a particular business model, the marketing model, back in 2017, which is very relevant in nowadays, isn't it? There is no line, no line. Social distancing is not a problem. You just need to go inside, take your things, and you need to just come out outside. So that is what I'm talking about. The future is here. Future is not over in the future. And especially what is important, our customers are thinking of contactless practice. Are we ready for the contactless promotion? Reimagine the concept, customer and consumer. Thank you very much for the time.
Thank you, Piyush. Yeah. Yashwant, please.
Thank you very much, Piyush. Great learning and good insight. You have got a lot of feedbacks and questions you have got. That shows you how people are motivated and taking learning, right? So I will quickly run through the basic take-home message. Then we'll take some questions. Then it will be open for discussion and everyone can respond to some of the questions, right? So Piyush told about COVID graduates. Started with project graduate. In the chat box, I have asked if someone can give the full form of COVID university full form. What he has told is College of Vitality, Insecurity and Disruption. That is the full form of COVID he has given. And then Piyush has given us a very good theory of marathon runner. What we can learn from the marathon learner, that is get your head straight. First thing is get your head straight, realign team. Second is burn your fat. Lean out all repeatable processes which are not resulting in something good. And third is build muscle selectively. So free up leadership time. All the leaders, managers and leaders, they need to free up their leadership time for critical tasks. So don't waste your time in some routine tasks. and keep the leadership time for critical ties for motivating, inspiring people. Then 3 Ds Piyush have shared: decentralized, delegate, and decide. Very easy to remember also. And then the key he has shared is communication, getting straight talk. Very, very important in this time because people are having uncertainty. They are confused. What is their roles, responsibility? As a leader, we need to communicate, giving them clarity about what is the things they have to do. Getting straight talks. Then another very good diagram Piju shared, influence diagram, which says that what is the situation, then what do we do for this, how do we respond to this situation, and third element, what is the outcome, and fourth element, how do we like it. Wonderful way of to implement this tool in any situation. Then need of the hour is the pace, speed, and agility. We need to have the speed up and agility. There should be a balance between customer and consumer. Digital marketing is the way of life. And also, he told about the contactless promotion. We have to think of how we can promote our products to contactless. Thank you very much, Pijus. Really good learning. And there are some questions. Let me take the questions first. Question is from how to manage time at the workforce. This is Tahir Qureshi has asked how to manage time at work from home. Means, as you know, lot of time we are spending in work from home, and as per the Tahir Qureshi, it is more time what we spend in the field work, more than that we are doing spending on work from home. How to manage that? Just if you can add something.
Yes. So very relevant question, because that was the first question I asked myself when the work from home mail I got as a salesman,
Yes.
And that was a very tough time of realizing that it is possible in this particular scenario. So the answer would be there is no ideal answer for that how to manage work from home. What I can say is that planning is the most important part. Just I remember a particular case that one of my friends has shared, one of the $1 billion company, how they plan. So before implementing anything, they plan for at least for 3 to 4 years. So that is the planning phase that they spend. And after that, while implementing, they just focus on the implementation part. So right now, whatever time we are getting, it is the planning phase. So plan your every move that you are going to make, number one. Number second, do not think about that you are at home. So build a habit just like office. So you are just like sitting at the particular office at 10 a.m. and you are, segregating your work, the most important work. Then you are having the lunch break, and now post lunch break, what are the work that you are doing? You need to select that what kind of communication that you are going to send to the particular team. So a culture of habit is very important managing work from home. Number third is do not stress yourself out. Do not think that my job is only at field, and so I don't have any job to do right now from work from home. For that reason, what you discuss about digital is the need of the hour, and what kind of communication you are making to the doctors, to the customer, to the consumer, to any stakeholders, be it a pharmacist, stockist, or hospitals. That is one of the most important part that you need to take care of. And my dear friends, training is required in this because we are not champion communicating digitally. Whenever we are calling somebody over the phone, we are searching for the words. But whenever you are in front of customers or consumer, you are confident enough. So that habit you need to build upon. So that part, if you are trained yourself and your team, certainly you can manage work from home.
Thank you very much. Really good insight. Arindam Patra has asked one question, Pijus. Real situation he has given. As you know, this question is from Arindam Patra. Footfall has decreased. Patient footfall has decreased in doctor's chamber drastically. In this situation, how to generate new prescription? Okay, exactly. That is the question. How to generate new prescription in this situation? Any tips you can give?
Exactly. So it's a very relevant question. So the patient footfall has decreased at doctor's chamber, but some segments are growing at more double digit and achieving 100% target. So how does it happen? It means that patient has gone nowhere. They have just saved the doctors. Suppose earlier one particular patient is, they are at particular village and he or she used to travel 50 kilometers to the metro cities to see a doctors, which we call KBL or KOL. So right now, what he or she is doing, he has just shifted his doctor and he is seeing the village doctors, the particular GPs or the doctors whom we call, not so important in our language, them they are visiting. So the patient footfall has actually decreased in the metro cities. It has increased into the village and secondary towns and tertiary towns. So we need to see that where the patient flow has gone. It is not that with COVID all the diseases are gone. It is not like that. Only you are not getting the news, isn't it? Only we are getting the COVID news for that reason. Still, that there are more diabetic patients than that of COVID case, more respiratory cases than that of COVID case, and you name it, we have it. So we need to see that where the patient flow has gone in the secondary or tertiary market, how we can reach there, if not physically, digitally once again. How we can train those doctors to be digitally competent so that we can deliver our messages. So that kind of segmentation change we need to see, then only you can position your product. So segmentation, demography wise and patient wise is very important to know how to bring business in this particular scenario.
Thank you very much. There is a question.
Here is Viraj.
Viraj.
I just would like to comment on this because very valid question, and probably most of the medical representatives and even first and second managers are now struggling to get the answer for this. So one of the scenario which Piyush has said, just in alignment to that, during my topic, I think one of the zonal business manager has shared his view on opportunities, and where he clear-cut mentioned three important pillars of our entire marketing environment. One is chemist, other one is stockist, and third one is a doctor, right? So if you are really connecting judiciously with these three pillars on regular basis, by creating and making your conversation interesting, probably you will get to know how that business shifting is happening during this COVID pandemic. So with that observation, if you'll start learning the various ways to reach out to these secondary, tertiary towns pillars, probably the answer is with you only, and you will definitely win this game over the period of time. Thank you so much.
Thank you. One more question is there for Viraj and Rajshekhar both. This question is from my friend Gulbir Juneja, because that is why I am directing this question to Rajshekhar and Viraj. He says the secondary is down. Secondary is down very much, and how to manage gap between secondary and target. Any tips you can give? Got the point. So it's really a critical question. If you can respond.
Gulbir, and for all, if you just see, we were talking about footfall. That is a relevant subject. What I observed and we were discussing also is patients reaching up to doctor level, there is a decrease in the footfall, I agree. But many patients reaching up to chemist level, that is still continued because they are coming and buying the same existing prescription and going back. That is happening in complete chronic and I can say semi-chronic also. The major challenge lies with the acute, where the footfall directly depends on the liquidation. So there a huge challenge is there. Still, if you ask me, a lot of dynamics changed. Patients migration happened in a heavy manner. We should really look out. I'm connecting from where Viraj left in the previous answer. We really need to look out where the sudden surge happened with many of the secondary, tertiary towns. And some of the smaller distributors started suddenly doing much better than what they were doing earlier. We need to identify all these locations where the sudden surge in stockist performance started happening. That is purely because of migration. We need to really align our business planning based on that and increase our effort at total channel level. That will definitely going to help us in order to ensure a better inventory at the secondary market as well as at the primary market. That is one part. Apart from that, yes, patient-doctor connection, which Viraj was talking about, is also very much important. If through digital mode, a lot of efforts are already going on in the industry, where how I can really connect doctor, patient, and close the circuit with chemist. If I can able to really fix it better, then I can damn sure that we will rebuild that patients who are sitting at home without taking the right consultation and using the right medication. I think it's a whole lot of exercise. That's what I told about planning it again in the changing scenario with the changing dynamics of the market.
I just want to add something.
Vijus, please add.
Yeah. So just to add up with what Mr. Rajshekhar is commenting on that. See, there are in chronic and semi-chronic, there are two parts that we know. One is refill business and one is new prescriptions that we are talking about. So refill business might be contributing over 60 to 65%, and rest of the things is the new prescription. So whatever the drop in patient flow we are talking about is basically the new prescription drop that we are talking about, that is contributing 30%. But are we strong enough with the refill particular part? The way Mr. Isaac told and Mr. Viraj is also commenting that what we are doing to see that what the chemist is doing, what the stockist surge is happening. So that we need to focus upon, so that at least we can save our 70% business. And if we can grow there at least by 10%, your job is almost done.
So just to add last comment on this wonderful question, and probably everybody is marching towards this to find out the real answer. And as the situation goes on worsening in some of the parts, and some of the parts it is getting under control, I think we all are facing the difficulties. But the most important attention I would like to bring it to one of the great leader, teacher, icon of this century, great Dr. APJ Abdul Kalam. What he said was, in between, difficulties in your life do not come to destroy you, but to help you realize your hidden potential and the power. Let difficulties know that you too are difficult. So what does that mean? You know, we are going through this difficult phase, but don't give up. One of the presentation of Pijayu's last slide, he was draw our entire attention to our core of our entire working, which is nothing but a patient, right? Till yesterday, probably we were more aggressive on our direct customers, that is maybe doctors, chemists, and the stockist. But we have forgotten to reach out judiciously and with the same aggression that we used to have at our primary direct customers like doctor, chemist, and stockist. We have left out the patient. So start reaching out to the patients. As Rajshekhar was also saying, and even Piju's presentation, it has came out strongly, only the business proportion has changed from the metros, mini metros to the secondary, tertiary town. That means the patients are intact. We need to now find out the various innovative ways to reach out to these patients and to understand from where they are getting those kind of medicines or the brands that you're promoting to. So if you'll start making this conversation interesting, probably you will get an answer, and you will probably make that secondary intact, and probably it is more because chronic segment and semi-chronic is the technical word that we understand. But for the patient, that doesn't make any difference. For the patient, only thing what he deserves is, if I am explaining my pain, I should be getting the relief out of that pain. And every colleague in this platform probably trying to give that solution. So if you're trying to connect with the patients with the various innovative ways, with the solid content, probably you will get an answer in a very prospective way. And I think I know Gulbir personally, he is working with respiratory and division. Probably they have started innovating ways to reach out to the patients.
True.
So
Thank you very much. Thank you very much.
These kind of ways.
Okay.
Thank you so much.
One of the newer approach, Arumugam has also shared answer to the question of new prescription, how to generate a new prescription. And what Arumugam has shared is, as most of the doctors have adopted telemedicine and they're giving prescription through telemedicine, we can try that also. Digitally connect with the doctor and ask them to give your prescription also through telemedicine. So you can generate new prescription to the telemedicine platform, and we can also support the doctors. So those doctors who are not aware about this digital media of approaching doctors, we can support those doctors to install telemedicine, and definitely partnership in a practice approach we can create. Thank you very much, Arumugam sir, for giving this insight. And some more questions are there. We have less time actually. One question from my friend Vinod Vaswani. He says, today also military-like culture persists in pharmaceuticals. Military-like culture means the saying of MR and ABMs are not heard in the HO, because many MRs and ABMs, they bring some newer idea, but people don't listen to them. While in IT sector, the culture is very open. IT sector culture is very open, but in pharma sector, it is military-like, regimental-like things, a taskmaster approach. So what is your take? He's asking, is there any possibility that open culture will come in pharma also? Rajshekhar can respond.
Yeah, if you ask me, frankly, I'm having a limited experience of one company only in my career for last 20 years, wherein I have seen a lot of open culture. Lot of open culture, I mean to say, huge number of wonderful strategies are flown from bottom up. It's a very strong bottom up approach. It's not that I am just working here, I am saying it. Whole industry really evidences it that wherever there is a bottom up approach, we are much ahead than the market. Usually it has been said, if top management notices a challenge or a problem, it's already a 6 months late in the industry. But here, if you work on a bottom-up approach, you are hands-on in on the happenings in the industry, as well as the openness to the ideas is always a very, very important aspect. And a lot of such ideas have been respected, have been nurtured well to become a bigger strategy. And I strongly agree that this kind of a situation, where this current pandemic situation, it varies from place to place, state to state, and from category to category. And if any company not adopting that kind of a culture today, and there is no future for them for sure. I think all managements will be definitely are agile to look out for this positive support from the ground, so that they are open for good suggestions from any corner of the team.
Thank you very much, sir. Thank you very much. Good learning. Okay, that is one thing I want to mention before we close and hand over to Raman Marke for closing remarks. Mukesh Mahajan, one of our friends, has also shared a good things. Would like to share. He has told that problems are opportunities. So this problem is also an opportunity for us, and leaders, all the managers and pharma leaders, they should sensitize the team first. There is a need for sensitizing team for digitalization, adopting the digital culture. And there are two-way theory he has given, two-way theory. One is physical, one is digital. And there should be a fine balance between physical and digital. He means to say that we should try to approach doctor one-to-one physical way. Also, we should try to approach our customer through digital way. Thank you very much, Mukesh, for sharing this thought. And that is it from our side. It's already late. Some quick recognition for those people who have shared a lot of learnings. Amol Marathe was there. Then Kushagra Mathur, my friend, and Bhavik Patil. Thank you very much, Kushagra, Bhavik, for sharing your learnings. Gulbir was there. Deepak Loyalka has shared a lot of good things. Vinod Vaswani, Sabyasachi Mukherjee. Thank you very much, Sabyasachi, for sharing your thoughts. So, and Yuvraj also has shared his thoughts. Some of the questions we could not take because of the time constraint. Over to you, Raman. If you can give the closing remark already. Yes.
Thank you so much, sir.
Yes.
Yeah.
I need to mention Chakri Sidhu sir.
The
Chakri Sidhu sir has shared a lot of things. Thank you very much, Chakri Sidhu sir. And over to Raman.
Yeah. So thank you so much to all our Facebook and the YouTube audience. And as always, we are like the observing this audience number is increasing. So first category is our live audience. We started with the live audience, but today we have crossed. Today is the first landmark that we have crossed the 100 maximum in between the 80-90 live audience. They were there in between all the three sessions. So thank you so much to all our live audience consistently, continuously from the 2 hours that you are like watching us, all our three speaker. And of course, last we have crossed the 6,000 reach when it comes to a 1 week reach of last LPC-9 program, and adding the reach, people reach in our both the channel LPC as well as the LPC Facebook and the YouTube both. And the highest what we got it the 15,000 the people, those who has reached to our the one Facebook page in the last week. So thank you so much to all our the like watching us, participating into the question and answer sessions. And of course, the second is our speaker. Yes, thank you so much to all today's three renowned speakers, Mr. Rashekar, Viraj Pawar, as well as the Piyush, for giving the good insight about the all three good speaker, which has been like the monitor very closely, as well as the monitor as well as the panelist. Thank you so much to our evergreen monitor, Mr. Yashwant Mishra, sir, as well as the panelist, Ashish, sir. So thank you so much, and I will over to you, sir, now.
Thank you very much. Yes. We can go ahead and we can go offline. And last but not least, if you have not gone offline, all those who want to share things, please join our Facebook page. Live Pharma Coalition Facebook page is there. So all of you can go and join that Facebook page, and you can share your thoughts there also. It will be a learning platform. Thank you very much.
Yeah. Thank you so much. Bye.
Thank
Thank
you.
you so
Thank
much.
you,
Please
Ashwan.
do take
Thanks,
care of.
LCS.
Thank you.
Thanks, Raman. It's a wonderful time spent. Thank you all.
Thank
Thanks,
you.
Viraj, Piyush.
Yeah, thank you,
So we
Rajshekhar,
have
Piyush,
thank
Yashwant,
you. Thank you. Great
ICS,
learning.
Raman, and entire audience for the
So
patient listening and contribution with their thoughts. So, last but not the least, but please do take care of yourself, because this pandemic has taught us how to take care of yourself first. That is most important. And going ahead, probably one of the great line from one of the great martial artists, Bruce Lee. You might have known to him. So what he says is the most dangerous person in the world is who listens, who thinks, and who observes. So probably this situation full of challenges uh, will give us that opportunity to every individual to emerge as an that dangerous person to lead this entire show and to show the world way of new life. Thank you so much. Please do take care of yourself. Stay
thank you.
safe and stay blessed.
Thank you very much. You can
Thank
go
you very
live
much.
now.
Yeah.